At this moment, we're now going to start the panel one of our session for this morning. And the topic for this particular session is about how did you get ready? So we have here a set of questions that we're going to ask from our panelists, and then they're going to share some of their ideas in terms of how they were able to implement the limited face-to-face classes in their respective institution. And at the same time, from the perspective of the Commission of Higher Education. Let's now start for our first question. Now, the first question for this particular session is about this particular question. Let me read this. When President Rodrigo Duterte approved the first implementation of the limited face-to-face classes in medical and allied services, as the president or administrator of the university, how did you manage the implementation in terms of the campus retrofitting or the facilities management? I guess the first question is, we can ask it to Dr. Perez from the Vice President of Academic Affairs from the Central Escolar University. And I believe also Dr. Perez will share some of presentation with regards to this particular session. Doc?
May
yes,
I
Doc.
share my presentation? Okay, so good morning, everyone. So when the pandemic started in March 2019, actually the closure of classes for school year 2020-21, Central Escolar University had a slogan, and that is continuing education and engagement in the university. We feel that we need to open our university to students so that they will be able to move on to the courses that they are taking. So we prepared the learning continuity plan, and the mode of instruction at the time is online, and we have to also think about how to engage our learners. Okay, so all lecture courses shall be conducted online. Laboratory courses shall be also done online. This is part of our learning continuity plan with simulations and videos. Internships, OJTs, and practicums will use the alternative learning strategies and will also be conducted online. Clinics and dentistry, this is our problem, and optometry, RLEs in nursing, and internship in medicine were scheduled towards the latter part of the semester, hoping that there will be some face-to-face because our students will not be able to graduate unless they do some of their clinics due to the board exam that they are going to take. So we arrange our classes the semester by blocks, and so therefore these are scheduled towards the end of the block. So finally, in February 2021, Chairman Prospero de Vera and Secretary Francisco Duque III signed the Joint Memorandum Circular Number 2021-001, and this is the guidelines on the gradual reopening of campuses of higher education institutions for limited face-to-face classes during the COVID-19 pandemic. So actually, what we did was just to follow what was indicated in the JMC. No? So we followed it to the letter and ensured that they are done in the university. So the first thing that we did was to establish the Crisis Management Committee, as also stated in the JMC. And so, of course, the persons involved is our university president as chair, the deans and the program heads in our different campuses, who is actually helping the president prepare the things that we need to prepare for the gradual reopening. And we have, of course, our university physician, because there is also there the health and safety health protocols, and then, of course, our university engineer who is in charge of the facilities. So we prepared for the following: the students, faculty, facilities, and the health protocols. Okay? So for the students, what did we do? The first thing that we did was to have meetings. The deans had meetings with the parents and the students to give them the guidelines on the limited face-to-face, no? Because we really have to be very serious, because the condition also at the time was still very serious. We do not know the spread of the virus, and so we really have to be very, very careful. We need the parents to understand. So we need parents consent. No, we need parents consent. And then of course we talk about accommodations. We made sure that our students are bubbled, so we allowed them to go home in their respective houses, provided that they have their own vehicle, or if they will be brought to school or fetched from school. Otherwise, they have to stay in the dorms that we have accredited for this limited face-to-face. Because the dorms, we have Rental B, who is arranging for these dorms, and we make sure that they are also bubbled. It is full board and lodging, so there is breakfast, lunch, and dinner. So the lunch is being prepared to be brought by the student in school, and then they eat dinner at home also. So they have to, parents have to understand all of this. And then we have to prepare the cyclical shifting method depending on the capacity of our clinics, because we made sure that we follow also the guidelines on social distancing of the facilities that we have. Then towards the end, we have also ensured that our students are vaccinated already. So those who you still do not have vaccination in their areas, we made arrangement with the LGUs in Manila for Manila, Makati for our Makati campus, and in Bulacan for our Malolos campus. So we arrange, and we are happy that the local government has been very supportive to us, and they allowed our students to be vaccinated. Although, of course, there are only about 85% when we started who were vaccinated, because some really would not want to have that vaccination. And then before the start, when they come to school, there should be an RT-PCR. So initially, this was also arranged by our rental bid, the one who arranged for the accommodations. So they were able to get them for free somewhere in Manila. I don't remember anymore, but because it's rental B. And of course, we have to make sure that there is an insurance. Every student have insurance. And then, of course, the accommodations. Now, for the faculty, we also conducted meetings with faculty. In terms of teaching and learning, we don't have to do that, because all our faculty know what to do in the clinics. And what is important is that the guidelines and the provisions that we provide for them. So we provide them PPEs, no, and of course the RT-PCR and antigen test, because we follow the 4-10. So if the students will come 4 days, there will be 10 days quarantine period, no? And then for the same with the faculty, 4-10 also. And so after the first time the faculty comes to school, then they should have the antigen test, and we provide them with that. And of course, accommodations also. Some of our faculty members who cannot travel to their homes every day stayed also in the dorms. Now, for physical facilities, this one was really very, very challenging for us, because we followed what is in the JMC. We put barriers in our dental clinics, in our facilities, and we had the dental chairs one seat apart. So we followed everything. But later on, when Chairman De Vera visited this university, because the barriers that we put up prevent ventilation of the good ventilation of those inside the barrier. And so it was suggested that we remove all the barriers that we have placed. No? So ventilation is very important. So we added exhaust fans. We opened all our windows even though our classrooms are air conditioned. Then of course the signages, the isolation facilities. This is a requirement by also by the JMC. Then of course alcohol dispensers, waiting areas, entrance, exits, trash, including trash bins. Because in the clinic, our students, the clinic, they wear PPEs and then they have to put in special trash bins. And we have a transporter of these waste products. Then, of course, they also arrange for the accommodations of part of their job was the accommodation. Then the health protocols, we have university health protocols even before the limited face-to-face because we have some non-teaching staff who goes to school. Our university health services ensure that they are being followed, prepared guidelines for entry and exit in the university. Entrance, they have the health declaration, and exit, they have the contact tracing. Then vaccination of all those who are attending to the students, like the faculty, that's faculty, laboratory technicians, janitors, and security guard. We make sure that nobody he is assigned to our students unless they are vaccinated. And then, of course, they also prepared contingency measures in case when students will have a rise in temperature while they are in school. And they are in charge also of our RT, PCR, and antigen test. The RT-PCR, we do it outside school. The antigen test, we do it inside the school because we have a clinical lab. Okay, so these are just samples. So this is the accommodation where our students are bubbled. So as I said, Rental B is arranging this for us, and this is full board. So the students can choose one bed, two beds, up to 4 beds. But provided that there is only students from CEU are occupying that room with 4 students each or 2 students each. Okay, and then we also, these are some of the samples of the signages. We have also some struggled when we were visited because this should be very, very conspicuous. No? So we have plenty, but then the team who visited us would want this really very, very big. Very, very big, that even though that you are about several meters away, you still can see them. Okay? And then, of course, sample posters. And then these are samples of our clinic. So also, we have to make sure, although we have already designated, remember, you look at the X, it means to say that there are no students there. Then the posters also regarding physical distancing, etc., are still placed on the table. And then the guidelines are there. So you have them on the table, you can see them on the walls. Okay, so there are no barriers. We remove the barriers because you will see we have plenty of windows. It's entirely windows. So we just open the windows, and then the other side is the corridor. So we also have to open. So this one, the first, does not, you look at the X, it means to say in the dental chair, it means to say that's a dental chair that will not be used. So all in all, we can only accommodate 38 students in a batch. 38 because we have 4 floors actually of dental clinics, and we use also our skills lab for some of them. By the way, this is face-to-face for the student, but there are no patients. There are no patients. Our students use phantom heads and model jaws for their clinics. Okay, and then of course, this is also example. So at the entrance, you have the alcohol, and then the thermometer, the temperature is being checked. The students do their health declaration, and then there is also a foot bath and the foot bath actually is to sanitize the shoes. Okay, and then of course we have also markings where how regarding foot path, no, foot path. Then so this is an example of our isolation facility. So it doesn't need to be big. just has to have one bed. And then, because the students will not stay long, we tell our students if they feel bad for the day, then they should not go to school. Even though the temperature is still okay, but if they don't feel well, they should stay at home. Because we said that the moment that one is sick, then everybody would be affected because we will close down the clinic for an entire week. Okay, so there is also ventilation and exhaust fan in the isolation room. And then, so this is also, there is instruction, this is the instruction on how they will be able to do the health declaration. Then classes that took place before the MECQ again. So we have classes already. These are our students. They are in PPEs, no, from head to toe, including the one in the feet, no. So they are covered. Okay. So they are alternate. Okay. So these are, as I said, they did not work on patients, but phantom heads only. Okay, and then of course you can see also the shoe, you call that, something that you put in the shoes. Okay, and then of course, before the MECQ, we have 214 clinicians who participated in the face-to-face, and actually, these are actually students who are supposed to graduate in 2019. These are students who are supposed to graduate in 2019, but they were not able to do so because they were not able to complete the requirements of the clinic. So we were able to finish that. And those who were supposed to graduate the first semester of 2020-2021. Okay, so we still have students who are supposed to graduate last 21-22 July, who still should do clinic when we are allowed again, because in August we had the lockdown again because of the MECQ, and of course we had the GCQ level 4. We still are not doing clinic, so we were now in level 3. I'm not sure. We will be talking about it. We will see how safe it is for our student, because we know the Delta virus is airborne and much more, they can easily spread more than the COVID-19 that we had before. You see also here the footpaths. So this is how we prepared. These are some of the references. So thank you very much.
Thank you so much, Dr. Perez, for that comprehensive presentation. It shows that how CEU really intensify their effort in doing this systematic way on how we make sure that aside from learning, we also deliver the safety and security among our students. So on the sharing of Dr. Perez, she was able to cite some of the practices of the CEU, specifically the College of Dentistry, if I'm not mistaken, to be some of the model of the College of Hospitality and Tourism to consider in the future run of the limited face-to-face. So thank you so much, Dr. Perez, for that presentation.
You're welcome.
Apo. Thank you, Dr. Perez. So I think we can now proceed to the next question of our panel. To our panelists rather. Okay, so this one is about how did you manage the expectation and confidence among the students and their parents about the conduct of the limited face-to-face classes? Were there any safety measures and protocol raised by them? Since Dr. Perez were able to show already that the CEU conducted the Dean's meeting together with the parents and the students, I think we can ask this to Dean Ebuyen for regarding his insight about this particular question. Dean, the virtual floor is yours.
Okay, thank you, sir. So may I share my screen?
Sure, sir.
Yeah, actually, I answered all the questions that you sent us. And so I'm ready, actually, in my capacity as the president of the MedTech Associations, and of course, as a member of the composite team doing the rounds in assessing the HEI's preparation for the conduct of the limited face-to-face. But anyway, yes, Okay. Okay, can you see it now? So
Yes.
yes, anyway, I'll just share some of my slide. Yes, the same process went through with all the member schools when they prepared for this, and of course, attending to the attendance to several orientation of the joint CMO made them easier to understand and interpret the JMC. So it all started with the creation of the HCI committee, then assessment of the HA current condition programs facilities. If there are areas needs to be retrofitted, they plan and formulate policies, guideline vis-a-vis joint chair DOHGMC in consultation with LGU. And this is in terms of identifying the facilities to be used, the safety and contingency measure, the curricular revision for flexible learning. Okay, so they also conducted orientation with the stakeholders by presenting the HAS plans on retrofitting, safety measures, and protocols. Then after that, after getting the affirmation or affirmative side of from the student or the stakeholders, they went through with the retrofitting of facilities, because there was this shared to us in our group that there was this one institution which prepared ahead of time their facility before conducting the orientation, and only to find out that their stakeholders are not agreeable. They don't want yet to go back to school. So ano po ang nangyari doon sa kanilang preparation ay nasayang lang. So tama lang po na talaga i-conduct. We have to conduct the orientation before we start retrofitting. But at least we have already had the plan. And this plan should be presented to our stakeholders during the orientation meeting so that they'll understand all those preparation that was made for them, ensuring their safety when they finally go back to the school. So after getting their yes, I said, the HEI has already started retrofitting the facilities to be used, especially the laboratories, because we don't encourage in the team that all the facilities will be opened in the campus. Only those facilities that will be used by the students are supposed to be opened, so that we will not be encouraging them too much mobility inside the campus. Yun lang pong dapat gamitin ang dapat nabuksan. So that is how other schools have done. Then after that, they conduct institutional assessment. They went through a walkthrough or simulation. Then after the simulation, they proceed with the polishing the guidelines. And if there are still areas which needs to be retrofitted, then they push through with it. Then after that, they apply for CHED for authority to offer limited face-to-face classes. So the question directed to me is this: how did you manage the expectation and confidence among the students and their parents about the conduct of limited face-to-face classes? Were there any safety measures and protocols raised by them? So this is how we conducted, or some of our PASMET member institution conducted their orientation. So during the orientation, they should have already had prepared the plan for the retrofitting and their programs, because we have this experience before this. All we thought is the orientation is just asking the stakeholders if they agree on the opening of the face-to-face classes. So in our first meeting, we really have spent long hours, starting from 8 o'clock to 1 o'clock in the morning, because there were too much issues, there were too much apprehensions raised by the parents. So kasi ang nangyari, ang orientation lang ay ang pagtatanong ay sila ba ay agreeable doon sa idea of opening a limited face-to-face. So yun po ang nangyari, ang haba po, at especially those schools with big enrollees, ang dami pong mga magagaling na magulang, ang dami mga legal issues na kanilang tinanong. So that is a lesson for other school when we learn their experiences of those of that school. Then nag-orient na lang sila, or we conducted the orientation after we have already finalized all the plans on the retrofitting, the policies, on the revision of the programs that we're going to implement for the face-to-face classes. So what are these? We presented them the facilities to be retrofitted from the entrance and exit points, the triads, the walkways or hallways, or the traffic on those areas, the isolation or holding areas, even the washing or sanitation areas, because all of these points should also be retrofitted. There should be a visible traffic signages, foot markers, yung mga directional signages, safety posters, kasi titingnan din yan. We have also to consider yung traffic flow. Is this a one-way traffic or a two-way traffic? So that depends on the on how wide is the hallway or the stairs of this institution. So we talk about also, we presented them also our guidelines on student mobility, kung saan lang sila pwedeng pumunta, saan lang sila pwedeng papasok, lalabas. Yan ay diniscuss namin. Ano ba yung policy for transporting students from and to the campus, those who are staying in dormitories, yung then yung mga access area nila, like for example, if they are only going there for laboratory activities, then it's only be the laboratory where they can enter. Because in the team, we also still discourage conducting lecture, not even opening a classroom for a holding area. That would encourage groupings of the students. So even the meal area, if they can eat inside the lab, then we allow that. But if, however, there's no space, then we also or advise them not to have their separate meal areas with all those barriers na kanilang it should be facing the wall. So we have all those guidelines or advices to these schools. Then also they have also to visit the restroom, how many people or person are allowed at a time inside the restroom. So because we have to ensure that in these places there should also be physical distancing should also be observed. Okay. Then we have also to present them the face-to-face classes cycle and the sample rotation schedule and activities if already identified. So in the JMC, we recommend it's recommended that there are 2 cycles recommended actually, the 14, 10, and I think the other one is 14 or 17. But most of those health programs opted to adopt the 4-10 cycle, which means face-to-face for 4 days and 10 days quarantine after, while they are doing the virtual while they are doing virtual classes. We also presented to our stakeholders the policies and guidelines on safety measures and protocols, the contingency plans, etc. Then, of course, the requirements like their insurance, and we advise them that they should have an insurance that could cover the entire cost of the COVID infection. So, and if they can afford to get another or other insurance other than the PhilHealth, then of course requirements such as the RT-PCR testing or antigen at least 3 days presented at least 3 days before they start with the face-to-face. Then an institutional policy for vaccination of COVID. This is not specified in the JMC, but most of the institution opted or make it as a policy that students should be vaccinated before they are allowed to, of course, join face-to-face classes. requirements for PPEs and health kits are also discussed during the orientation, etc. So with this, nakikita po pag ganito po yung presentation natin sa orientation na i-represent na natin, nailalatag na natin yung mga programa at ano ba yung mga balak, retrofitting plans ng ating campuses. Then nakikita na, they can already visualize and nakikita nila how safe will be their student when they finally go back, kung paano yung mga protocols, kung paano sila uuwi, paano sila ihatatid. Lahat po ay maging maliwanag sa kanila. Kaya noong kami ay nagtanong kung sila ay papayag na, then most of them says yes already. Unlike when we have the first orientation na lahat sila at the end, after the very, very long meeting with them, I think 4 to 5 hours, everybody says no. Wala pong pumayag sa face-to-face nung una. Pero noong wala naman po naging problema doon sa first batch na yon, because in PASMET, in our association, and even with our technical committee, yung mga po na internship nung mga nasa old curriculum ay pwede ng 100% virtual, because these students under the old curriculum before the pandemic were already exposed to laboratory activities, and their internship is just an enhancement on this and application of those another application of those activities they learned already from school. So with when we asked this to our PRC counterpart, then sabi naman nila, yes, alam namin yung programa ninyo. So these students na dapat mag-intern na itong mga old curriculum that was last year, ay i-virtual nyo na 100%, basta you follow the advisory number, I think number 4 on flexible learning, then you can graduate them. So yun po yung nangyari sa unang batch namin, kasi nga sila yung mga huling batch na nagkaroon pa ng talagang face-to-face classes or specifically laboratory activities in the campus. So ang aming stand in the committee and even the PASMET is yung ating face-to-face, this will be for those students enrolled in the new curriculum. At yung unang batch nitong curriculum, ito na yung pong unang this will be the first batch na covered na nitong limited face-to-face. So ganun po, naging wala kaming problema doon sa una naming batch, kasi nagkaroon kami ng stand and position namin yan sa TCMC, TC. Okay, so noong pangalawa na, dahil natuto na kami doon sa orientation na kinandak namin, ay wala na pong problema. Medyo konti na lang. Ako sa experience ko, isa na lang ang tinanong. Ang tinanong niya ay, sir, paano po itong anak ko na may asthma? So sabi ko, we have guidelines for that, and you can consult our university physician on what to do. So yun lang po ang naging issue namin during our orientation or tawag dito, consultation with our parents. Sir, thank you.
Thank you, Dean Ebuyen. I think this is what a good idea, because when President Duterte approved the limited face-to-face for HM and TM, this is one thing that I consider, the confidence. How are we going to put confidence among the parents and students? And if we're going to have this kind of orientation or discussion to them, I think magdadalawang isip na din sila if they're going to send their child doon sa school because of this systematic way. So thank you so much, Dean Ebuyen, for these insights, which I believe most of the administrators, students, and deans here in our virtual room were able to catch up or got their attention to this kind of ideas and activities. Thank you so much, Dean. I think we can now proceed to the next question. Thank you so much po, Tech Team. This is for the CHED, for Director Akiyate. So how the CHED Regional Office NCR handles the application for permit and reporting of the higher education institution who conducted limited face-to-face classes in the health-related program. Is there any assistance that they will get from it? Ayan. So,
Okay.
Director, it's yours.
Maayong buntag sa inyo tanan.
Maayong
Magandang
buntag.
umaga sa ating lahat. Naimbag nga aldaw tayo amin. And good morning to one and all. Because out of the 500 plus participants here, Sir Jefferson told us that there were some participants from Butuan. Oh, I was a regional director of Caraga before, and I know St. Joseph, no, a performing school there. And then I was also assigned in the Cordillera Administrative Region. Hello kayo dyan, yung from Kalinga, no? That's the farthest part of Mountain Province. And why I said the greetings in English is because Mountain Province is the only province with an English name, and they are English-speaking people there. Why? Because of the missionaries. You know, when you go to Sagada, they speak English well, even if ordinarily clad yung nakita mo, nakatapis lang na gano'n, old woman, just walking by the sidewalk. Aba, ang galing-galing mag-English. And of course, because we are in Central Luzon, we normally speak Tagalog. In the North, they are not that good in Tagalog, but they can understand. Okay, anyway, as for the Commission on Higher Education, no, before I answer that question, we also responded immediately, no. Itong COVID kasi na ito, when we were taken, flat-footed with the onset of the pandemic, nobody really was prepared, no. Worldwide, lahat tayo, we were taken aback. What is this? It never happened in the past, no? So, ang ano natin, as for me, no, and for the participants, we take this COVID issue positively. Why should I say positively? COVID is an acronym for me, no? Letter C is we have to be compassionate and we communicate. I saw that in my co-panelist statement. We have to understand the parents, the students, our employees, no? We should be compassionate and we should know how to communicate. Kasi ang ano dito, maraming nadidepress, maraming nagkaka-mental, mental health is very important at this point. So, compassionate, be compassionate and communicate. Know how to listen. No, do not talk and talk. Do not overburden the students with so many assignments. They have a lot already, no? And at home, where the kitchen immediately transformed into a classroom, the bedroom is no longer a rest room for us. It's not a place for comfort, no? Kasi we bring our lessons there. We have our, other activities, no? In that small area of our house. Ayan, yung una yan, we have to be obedient. Yes, nakita ko, sinabi lahat ng my co-panelists here, si Dr. Teres at saka si Dr. Bernard, no? We have to be obedient to the rules, no? IATF has already given guidelines, no? DOH, likewise, and the CHED, as you could see in the advisories, no? And the GMC, the Joint Memorandum Circular, spelled it all. Okay, we have to be obedient, no? We have to be obedient to the call of God. Do we know how to pray? We have to be obedient to our parents, to our family, to the community, to the LGUs, no? And we also have to listen to what social media, the good social media is saying as warnings, no? But do not dwell on liking fake news, or trying to add more fear by believing in what is not supposed to be acceptable. Okay? And letter B is versatility. We have to be flexible. We have to be versatile, no, in all things that we do. Okay? We have to be an inspiration for each one. Please be an inspiration to your neighbor, to your employee, to your students every day. Inspire by saying good words, good greetings, no? As we said, we cannot hug you physically, but we can hug you through text, through sending good statements that would lift up people. And letter D is you should be duty bound. We should be duty bound. First, we have, as I have said, duty to God, no? Never, never in the past have we ever prayed that much. Now we have to listen. There is a message, and we have to pray. We have to pray harder. Duty to our fellow men, duty to our community, to our families. Do not add stress. And finally, duty to the nation, so that we can rise above these problems. Yun lang, sinasabi ko kasi lahat ng sinabi ng mga kasama ko, all those, some of them came from DOH, IAPF, from CHED. No? So, as me, what particularly also in the region did we do? Establish, for the commission, there was this establishment of the Philippine, CHED Connect. Are you aware of that? Where we have there the OER, no, or the Open Educational Resources, where you can really access, no, for your teaching and your learning. We invited, no, writers, module writers, professors, researchers to put their, materials in this Philippine CHED Connect so that everybody can benefit from it. No? Yun. Tapos nag-ano tayo ng webinars. You know, this global professional advancement. Thank you, no? For the officers and the members of this. Actually, with the help of Dr. Aquino and the rest, Dr. Cordova, there were a lot of webinars. They've been talking about flexible learning, how we can prepare our students, how we can prepare our faculty members. They were really a great help to us. Kasi alam nyo naman, even if taga-CHED kami, not all of us are experts. So we need the expertise of the RQAT, the Regional Quality Assurance Team, no? Yung mga technical members of the panel like Dr. Cordova, Dr. Aquino, and the rest, and Dr. Bernard. No, hindi namin magagawa yan without you. And of course, the inputs of the VPs like Dr. Reyes of CEU. Nakita ko yan. I've been going around, no, to give the certificate of authority to open for limited face-to-face. Although I was not there during the evaluation of some schools. But I was from the very beginning there with Our Lady of Fatima University. Kasi may comorbidity kasi ako. There are some limitations. I cannot really go to the hospitals. No? So ganyan. But I saw how sincerely and committed you were, no, to carry up all these requirements for the sake of our employees, for the sake of our students, and for the sake of everybody, so that we will be safe and not to die just because of this virus. No? Ang ganda talaga. So, ayan, we came up with the flexible learning approaches. Yan. As cited in CMO number 4, no? Series of 2020. Nag-ano tayo dyan? Okay, so when it was given to the higher education institutions, we thank you for your good implementation. Nag-ano kayo? You did not sleep. You carried out what was supposed to be expected. The advisories that were sent to you, no, through the very active chairman of Chair Popoy de Vera. No, na ano yun. So, and then eventually there was this need and clamor for yung mga, how about our interns, how about their presence in the laboratory so that they can learn more, because we cannot really do all things online. And so we have also to let President Duterte, the chair went to President Duterte, talk it out with the IAPF, no, on how we can have limited face-to-face, no, programs. And your program on the hotel and restaurant management and tourism, no, is already included in the expansion. So yun, we need to retrofit our classrooms and other learning areas to keep us safe from the virus. Now you ask me, ano ba, may ano ba yan? ano yon, assistance? What kind of assistance are you asking? Because we can give technical assistance by the, by utilizing the composite team, of course, where Dr. Bernard was also one of them, and perhaps maybe Dr. Reyes will also be invited one time. Now, where we have the CHED supervisor as the lead person here. We have the DOH representative, the public health expert, we have the LGU representative, we have your technical members or your ARPWAT, no? And, if I may also say, we really thank the technical member panels and then the ARPWAT because they coordinated with us in the carving out of the instrument to be used for the evaluation. Kaya ang gaganda ng mga na-retrofit. You see CEU, you see MCU, and the rest that they visited. Nako, kay Dr. Bernard, hindi ka talaga makaano. Kasi, I was telling him, I will not be there kasi softer ang heart ko kaysa kanila eh. I might forgive them for this little, for these minor mistakes. But for them, no. Sabi ko, why am I not signing for this school? And they would tell me, ay ma'am, hindi sila nag-comply doon sa markings. Hindi sila nag-comply sa ventilation. Oh, you see how strict they are so that you will be healthy? See, yung mga parents dyan, yung mga students dyan, you should owe it to this composite team, the school also, no? Who are after your, health talaga. So, ganyan tayo magtrabaho, no? So, the design, the delivery of the programs to address the learner's unique needs, no? We're already given in terms of place, in terms of pace, in terms of process and learning. So, what else do we do? So, sabi ko, technically, we can be of assistance. But when you are asking for financial assistance, alam nyo naman, ang gobyerno, unless we can ask for their, budget from Congress, then siguro, paano tayo? So, sa mga ganyan, that is why we do not force upon the HEIs, no? Sabi ng isa sa members natin sa composite team, well, if you really think you can afford to have it, then you can have it. Nobody will force you kasi alam nyo ang capability nyo. No? So if you are not into retrofitting, then you have to make your flexible learning approaches quality. Okay? Yun lang ang masasabi ko. Thank you and salamat.
Thank you so much, Director Akiyate. This marks your message to us, Doc. Compassionate and communicate and versatility. That was really important, especially on the resumption limited face-to-face. Maraming salamat, Dr. Akiyate. Leading to the next question, another thing for Director Akiyate, I think this is also some of the questions from our respective schools and universities. What are the criteria or guidelines of the limited face-to-face classes for the hospitality and tourism programs? How the school can comply with the following criteria? Does it mean that the school should submit first the proposal and the setup that they made in their school to CHED, or the approval of the local government will do?
Okay. Yes, as we did with the other programs, you also have to invite us if you're really ready. You write us. Kasi how can we just go and say, titignan natin. There has to be an invitation and there has to be a letter, no? That you are ready, you want this to be evaluated because nag-set up na kayo, you followed the guidelines. But before that, of course, you need to be oriented. See, sinong magbibigay ng orientation? This will be composed of the CHED lead person, and of course, we have the ARPAT members, or the technical member of the panel for hotel and restaurant management, because they are really the experts in this program. They know what to look for in your retrofitting, what is needed. See, That is why as I have said a while back, the Commission on Higher Education are not experts in all aspects. The reason why we invite ARPAT members, the Regional Quality Assurance Team, the experts in the field, no? So that they will also help us. So, titingnan natin yon. Of course, Dr. Cordova was telling me, nakita na nila yung instrument, mag-ano yun. So, i-orient natin yung school para malaman nila kung what they have to prepare. And then they will write us back. No? Kung kailan sila pwede. So we can also invite the composite team and we will schedule. Then eventually, after the evaluation, now we can say, aha, you're ready, and we can now give you the certificate of authority, no, to offer limited face-to-face classes. Ganun. Actually, even if we are saying no, because in some of the newspapers, they're saying that we are now into face-to-face classes, yun ay iniisip pa and they are studying that because, that may be possible in some areas. Like, in my Maropa, according to Attorney Aliswag, the regional director there, syempre, may mga islands na never been touched, never been no? Wala pang pumupunta na virus doon. So, why should we subject them, to And then they have enough space, enough ventilation. They can be several meters apart. Unlike some Manila, where can you find that, no? The air is also polluted. So, it might be allowed to some. No? In terms of geographical location, in terms of vaccination, no percentage of vaccination, and other factors that we also have to consider. Yeah. Thank you.
Thank you so much, Dr. Akayate. So this is well noted. So in every time that each of the school will have their meeting regarding the limited face-to-face classes, CHED should be invited so that it could, secure you a permit to offer it for that kind of limited face-to-face. Thank you, Dr. Akiyate. So we are down to the last two questions for our panel. This is for the perspective of our administrators here. So how did you manage the safety and security without compromising the quality of education among the students? Ayan. So I think we could ask from Dr. Perez, the Vice President for Academic Affairs of the CEU Manila.
Actually, when we have alternative learning strategies, meaning to say that we were able to, the first time, last school year, before we started last school year, what we did was really to recalibrate our syllabi because we have to ensure that only those essential parts are taken into the online courses. Otherwise, we will not be able to finish. And so we did that. The entire university, the faculty members consisting of about 700, including the lecturers, undergo the teacher training for online learning and teaching last summer for 2 months. And the output of that training also are the modules that we put in our LMS. And we have included laboratories there. So actually what was left really are those that cannot be done cannot be demonstrated only, cannot be simulated, but really need actual skills. So doing that and knowing that, we felt that we will be ready. But then during the entire school year 21-22, we were not. And during that time, what our deans did was to meet with the faculty members and again study how they will be able to teach some skills online. So for instance, in our nursing, in our dentistry, and medtech, we had difficulty, but in dentistry, our students have their own instruments at home. And we talked to some of the suppliers of the dental materials near our school they are open to supply materials to our students. And really, we are very much appreciative of our faculty members who really went out of their way to be able to produce modules or lessons, because our modules are divided to lessons that will really test the skill. They use camera, video while the students are working. Then they focus to certain students. They see how the students are manipulating the instruments, and then they give their comments. Okay, and so they did also, our students did skills laboratory at home, and so with the teachers using all the devices that they can use. And then the same way with our nursing, so they did return demonstration using whatever they have inside the house, like beddings, etc. They use their own beddings, and the teachers are not video in the sense that they take the video and then the teachers watch, but they watch it actual as the students are doing it through video. So I can see that our faculty members really had that commitment to be able to serve our students, to teach them well. And so they were able to do that. And so these are alternative learning strategies. So that's why when they come to our limited face-to-face, our dentistry students only come 4 days. 4 days na lang yung natira nila. So it's 8 to 5, 4 days. So they only have to come to school once. And really, just to be able to do what cannot be done or validate what they have done while they were at home. So that is how we did it. But of course, we were able to do this because of the cooperation of our faculty members. Our training, the training that we did to our faculty members really did not allow vacation for our faculty members. That was last year. This summer again, we know that we need to enhance some more. We need to do more. And so 2 months again this year, they sacrificed their vacation to be able to work with us and do the modules and improve, enhance whatever we have given our students. So in CEU, actually, we follow a certain outline in our modules. So they cannot upload in our LMS if these are not, it does not follow the outline that we gave them, and they have not been validated. They should be validated first before we use them. So that's how we ensure that we offer the quality of education that we want to give to our students, even though that we are not able to meet face to face. We really made use of the alternative learning strategies.
There was a good twist, no, on the review of your curriculum, because there are some which were enhanced and you really reviewed and see to it that ito mga possible you can do this, but this one can be later. Because some of the schools were saying, especially those technical schools, no? Like yung sa flying school nga sabi, ay, lahat ng theoretical kunin namin ngayon. Because maybe next semester mag-improve ang we cannot wait because we do not know what will happen next, no? There is no assurance that when we wake up, wala na itong virus. So, I like what you are saying because nag-ano na kayo. Kasi itong mga schools na ito, especially like CEU, dati naman andyan na yung online nyo. Dati naman may LMS kayo So it's not really a difficult thing, no? But for those who are just starting, syempre maano sila. Because for those na may open learning, may mga na, kompleto na sila sa gadgets, it's just enhancing or adding more, no? But if you totally start with something na new, if yours is a small school, tapos kulang talaga. Financially, you cannot afford it. So, ang natin dyan is tie up with those who can. Kaya, ang consortium, no, is very important. I think Asia Pacific College is offering. Sabi nga nila, oh, we are equipped, andito yung IT namin. If they want to, enroll with us, mag-cross enroll for this, we can have MOA. Kasi there are subjects na highly technical, di ba? Tapos yung mga iba naman, it's a big brother, small brother relationship, like PNU offering something for the other teacher education institutions. So ganyan ang gawin natin. Let's be compassionate, we communicate with other people and share. That is now the key ngayon, sharing. No? How can we be so selfish? Wala naman tayong makuha dyan. Kung bukas namatay na tayo, wala pa tayong naitulong. No? So let's just keep on sharing, loving and caring. Thank you.
We do, ma'am. We do share. Any school who comes and asks for our assistance, we do, ma'am.
Yes.
We don't say
yes.
no.
I know.
Share, ma'am. Yeah, even us. Yeah.
Yes. I know. Because there are some schools who are telling me na, ay ito, very open naman sila, tinutulungan talaga kami. And when there are modules that we do not have, nagpapahiram naman sila. So we can also have ours, no? Hindi naman sila humiram para kopyahin, but it will give them the idea how to start on their own. Okay? Thank you. Again.
Thank you so much to our panelists. I think one thing that I had for this is commitment among, especially to our educators, who are going to deliver the quality or the learning for our students. Thank you so much. And to our last question to our panelists. From 1 to 10, please rate the level of readiness of our education system and the facilities in terms of the readiness of limited face-to-face classes nationwide. So to all our panelists, you can rate and then explain briefly why. From 1 to 10, how our education system, especially the higher education institution, is ready for this limited face-to-face classes. Let's start with Dr. Dean Ebuyen. Your insight.
Yes, sir. May I just add something because there's this question which we were not able to cover. Can I just share just a very brief sharing before I do my rating?
Sure,
yeah.
Dean.
Yeah, I share my slide and take a look on this. So there's this question raised on us. Ano ba to? Na ito, no? Yeah, can you see this?
Yeah.
Yes.
Yeah. Is there any adjustment in the tool of the teachers, such as the syllabus in terms of the implementation of the limited face-to-face? Is there any training that needs to undergo to intensify the readiness of the teachers? So I think hindi ito nasagot, but I'm ready for my answer here. So just to share, yes, this is what we have done in our group. We do curriculum instruction innovation because we have to comply with the flexible or blended learning modalities and to cater all types of learners. So we consider the learners with those stable internet connectivity so we can offer them a full online classes, learners with learning gadgets but with unstable internet connectivity, and we can have both the blended, the online or the offline, or those who does not have learning gadgets and no internet at all. That's the connectivity. So we could offer offline. We provide them print materials, or we call them the print learners. So yun yung another one. Then of course, the first thing that we do is to have to realign or map our learning outcome objective vis-a-vis the modality of learning. So we have to identify the cognitive or the knowledge which could be done online or offline synchronous classes. Then for the psychomotor, so itong psychomotor na ito ay, of course, this is what they need to go for a face-to-face classes or for actual hands-on manipulation, and the effective, of course, we expect them to demonstrate while they are already under the program, no? Because we are talking here of interns of 4th years, so those affective or attitude already being demonstrated by them. So our experience when we are doing our mapping or aligning is, to our surprise, we in our map, when we map it according to venue, according to venue, ang nakita namin ay almost it's even more than 90% of the learning outcomes in our programs are already could already be achieved through online learning. Most of those learning outcomes or competencies needed to be achieved for the program are already it's deliverable under online learning, and only few, probably less than 10%, yun na lang ang babalikan ng mga bata for a face-to-face learning. So yan po yung aming ginawa. Then after that, then nakita namin since this is the only area which they need to go back, then we end up only identifying one facility in the school which needs to reopen, and that's only the laboratory. So that limits, kasi ang principle namin sa IAIs, means sa composite team, is the shorter and the lesser the student, the better. The shorter that they stay, if they can, although we are offering a cycle of 410, if those left psychomotor skill could only be delivered or achieved, because they only go there for a return demo or a practical exam, because all these all these demonstrations should already be done, and it could be delivered online. So the only thing that we will only mobilize them back to school for the practical component. Of course, you should be ready with your assessment methodology appropriate to what you are evaluating, and of course the tool. Okay, so that's how we did. Dati na-overwhelm kami, kala namin ganun. But after remapping, remapping as to the venue of learning, then, as I've said, in our program in the medical technology, more than 90% of all those competencies or learning are achievable through online, and only around less than 10% needed to be a face-to-face learning. So yun po yung aming experience, or when we do revise or innovate our curriculum para maging flexible. Then to share also with you in terms of resources, natutuwa ako sa isang institution which we visited the other day. Yung mga OB activities nila, how could they come up with this improvised resources, yung mga gamit nila na yung kanilang experience kung paano paanakin yung pasyente nila. They come out with the box, they put an opening there, and how to do the IE. Wala po pong sigastos. So to share you po, retrofitting, if you are very innovative, very resourceful, kwan po yan, it will not entail a lot of investment. For instance, yung unang school namin na binisita, they did not really come out with the retrofitting. All they what they've done is to disperse all those laboratory equipment in those rooms which are not used. Yung mga lecture rooms, they turn it into laboratories. So wala pong nangyaring mga paglalagay ng mga acrylic barriers, because they have enough rooms to decongest the laboratory and to comply with the physical distancing ng mga estudyante. So that's all po. Thank you. So to rate the readiness, ito po ang masasabi ko. Okay, may mga How did you get ready? What criteria? Okay, so I have here, how did you manage the readiness?
The last question, Dean.
The last question. So proper curricular, proper experience. Okay, so this is my rating. So from my experience as member of the NCR Regional Assessor Composite Team for the conduct of limited face-to-face classes, this is an awakening of us. Although we are caught unaware, wala pong nakapag-prepare na kahit isang institusyon dito sa ating tinatawag na new normal. So this is an awakening on the real face of our HEIs. Readiness of the HEIs varies in the conduct of limited face-to-face classes. So they vary. Campus and physical facility, iba-iba po yan. Kayong iba, ang hirap po nila mag-comply. Yung iba naman napakadali, because ang ating mga vertical buildings po, yun po tayo nahihirapan, because we also have to see yung entrance. Isa ang entrance, ilang story yan, 12 story, 11 stories. So nagkakaroon po ng congestion dun pa lang sa entrance. And Yun po ang aming tinitingnan. Then in terms of instructional resources po, laboratory equipment, we discourage sharing. That's why naglalagay po tayo ng acrylic barriers, dapat ay may physical distancing, that groupings, pinapagroup mo sila so na violate natin yung purpose of having a physical distancing inside the facility. So doon namin nakikita dapat pala ay magbigay ng kanya-kanyang set na mga gamit, of course except siguro yung mga which entails capital equipment na yan. And pag ganun naman mga automated or capital equipment, sabi namin ayusin nyo lang yung schedule ninyo, ayusin nyo lang yung schedule at siguro ng mga bata, at sapat in between news ay siguradong na disinfect yan. So, of course, ang isa pang limitation ng mga is yung mga type of students. Hindi lahat po ng mga bata ay ready. They are financially capable to meet all of these requirements. So, yun po, ang nakikita ko ngayon na medyo masasabi ko na tawag dito, umihil sa ating readiness. So, anyway, I'm giving, sa aking experience sa pag-iikot ko sa NCR, rate of 6 at 50% passing, 5 passing sa akin, sir. 6 po ang aking rating. Thank you very much po.
Thank you, Dean Ebuyan, for this analysis and also to your rating. Dr. Perez, your rating?
Yeah, for me, a little bit higher than Dr. Ibuyan. It's 7, because I know that everything is in the JMC already. And I said we just have to follow. And because it is already there step by step. However, when we were doing it, there will really be problems regarding implementation. So we will have problems with implementation. I am not sure also, yes, probably private universities can cope because, you know, there are costs also. I'm not sure with the SOOCs. But again, because when you implement, there will be also, like for instance, we provide our faculty members PPEs that they use, and these are extra costs actually. And of course, there are these costs, even though they are just alcohols. You just imagine the volume of alcohol that we are using. There's really an additional expense. So that's why, as I said, it's in the implementation that I'm thinking of. And so therefore, maybe, and we have to really be very, very serious in the implementation. We have to be very serious that we are on our toes when our students are already in the school. You know, our deans and our faculty members have to monitor if our students are at home already. They have to text the teacher that they are home and they are well. And they are to text the teachers in the morning if they are going to school or not. So there are really additional tasks being given to the teacher. So we have the guidelines. It's easy to follow. But then, again, the implementation, we have to be very, very serious also. So I rate it 7.
Thank you, Dr. Perez. I agree on that. As a teacher in a local university, it will be a challenge also to us. And of course, Director Akiate, your rating, ma'am?
Yeah, in a scale of 1 to 10, I would give a higher score. No,
Yeah.
I believe you can be rated 8. Why I say this? Because, you know, according to the October 14 editorial of Manila Bulletin kasi, sabi doon, among other things, no? It cited, among other things, that there is an education principle that suggests how learning can be maximized when more of the body senses are involved or utilized. Kaya, why should I say we really have to go for these face-to-face classes, limited face-to-face classes? Well, it's because, you know, the more senses you use, the better is the learning. Socially, you really have to see how your teachers would have their facial expression, diba? You can remember that. If they have to emphasize something which cannot be felt in the online aspect. No? And then there are some, innate aspects of encouragement. Kaya lang, kaya tayo nagre-reproof it is because we really have to protect ourselves. We like this, no? We want to go into the classroom, but we have to be very careful outside. Hindi lang naman sa school. Even if retrofitted tayo sa school, everything is managed. What about the outside environment? So we also have to protect ourselves. But I believe, as I have said, if the bigger schools would really help the smaller ones in the form of consortium or maybe partnership, it would not really be a problem. So I give 8.
Thank you so much. Yeah. Thank you so much, Dr. Akiate, for that 8 score. So as much as we want to extend this panel discussion, this really very engaging, very educational and interactive, but we have another 2 panels to come. So I only have one question. This is for Dr. Akiate. I think this is the majority of the question from our attendees. Are we going to release the same JMC that was happened for medical courses for the HM and PM, since I think most of the deans and administrators are waiting for this JMC to follow?
Yeah. I think we really have to wait for that because it is ready for signing, but I am not ready of the content yet. So it's not also safe for me to pronounce now. But I know the experts here can say something about it, like Dr. Cordova and the rest, Dr. Aquino, kasi sila naman ang naggawa niyan. Thank you.
Thank you so much, Dr. Akiate. So for other questions, we're going to give it to the panelists. There are some questions regarding OJT and also some principle about retrofitting. But ayon, thank you so much to our panelists for this session, Dr. Akiate, Dr. Perez, and Dr. Ebuyan. It was really nice to discuss with you this kind of topic, which I know most of our educators and administration learned from this. So thank you so much to all of you, to all of us here. And for our poll a while ago, we asked the question, which of the following is the number 1 success factor of the first implementer of the limited face-to-face education in medical and health allied programs? Majority of the response answered letter C. That's 36%, and it's about institutionalizing safety protocols and policies. So still, safety and security is the number 1 priority for the success of this new normal or the limited face-to-face classes. Again, maraming salamat po sa inyo lahat, and thank you so much for an engaging panel 1 discussion. Going back to you, Sir RJ Puno, maraming salamat po to our panelists. Thank you so much.
Thank you very much, Professor Marcelo, for steering panel session 1. And of course, thank you very much to our dear panel speakers, Director Virginia Akiate, Dean Bernard Ebuen, and Dr. Teresa Perez.